Hello everyone, my name is Aksa and today I'm going to talk about case number 4, which is implementing a telemedicine solution. I'm going to start off by giving some background information about the case. So this case is based on Grand Hospital, which is located in a rural area of Midwestern state. This hospital is operated by a number of competitive individuals, and it also has an 8 credit rating from Moody's and Fitch. The Grand Hospital on average has about 11,000 inpatients and 160,000 outpatients, which encompasses about 36% of its 36% of its services to be offered by the healthcare department. This hospital already has some technological advancements implemented already. For example, they have the PACS system, they have EHR, and then they have lab and pharmacy management. The main goal of this case study is to come up with ways to increase physician coverage in departments such as radiology, behavioral health, and critical care management. So in terms of the key problems that are mentioned in the case, there aren't physicians available in those departments, specifically radiology, radiology, psychiatry, and hospital ICU. But there are also not enough physicians available for reasons such as high malpractice insurance costs, an absence of substantive tort reforms, and unfavorable rates of reimbursements. The radiology department needs a radiologist available 24/7 to interpret radiological studies and results by the patients. They also need accredited psychiatrists available to make behavioral assessments in the emergency room 24/7 to make suggestions if the patient should be kept in the hospital against their will or they should be allowed to leave. And last but not the least, the hospital also needs physician coverage in the ICU department in case there aren't physicians available in the ICU at all times, or the voluntary staff in the hospital ICU is not available to supervise the patients. So in terms of the analysis, I came up with the solution that they should have telemedicine implemented at the different departments of the hospital. I believe the telemedicine is very cost effective, it's clinically effective, it provides better delivery of care, there's an access to a healthcare provider 24/7, and there's also improved healthcare outcomes. And most importantly, it's also less expensive. Implementing telemedicine in different departments could be very beneficial. For example, in the radiology department, you can implement teleradiology. In the psychiatry department, you can implement telepsychiatry, and in the ICU department, you can implement a remote telemedicine software. So by implementing teleradiology, basically you'll be sending all the images that need to be evaluated to a facility that has radiologists available 24/7. They just analyze the studies or the images, and they can send a report back to the hospital. In that case, you would not need to hire a radiologist on site at the hospital, and you can still get advantage of all the advantages of having an on-site radiologist. You can implement telepsychiatry by having a psychiatrist available on a computer screen that can evaluate and make behavioral assessments and ensure that what kind of patients should be kept at the hospital and what type of patients should be allowed to leave. And lastly, you can implement a telemedicine remote software in the hospital ICU that can provide a physician supervising on a computer screen 24/7, and they can let the hospital staff know in case a patient needs immediate care. Physicians can also be they can also be paid incentives and reimbursements based on their performance throughout the year, and that could obviously motivate a lot more physicians to be hired and take part take part at the hospital, and a hospital can have unilateral tort reforms for all the physicians that would allow the physicians to be more comfortable and to be working in with the hospital that provides so much support for the physicians. So in conclusion, telemedicine is cost effective, as I mentioned before, and implementing this procedure would add a greater advantage to the hospital. A telemedicine approach such as teleradiology, telepsychiatry, and telemedicine in the ICU can allow greater patient coverage. There is a physician available at all times, even though that is through a computer screen. But in case somebody needs someone needs like healthcare, there's somebody available that can address all the issues. It's better than not having a physician on site. Also, last but not the least, physicians will be available to attend the patients even if they're not available physically at the hospital. Okay, so lastly, I'm going to talk about the implementation process. So there are a variety of steps that I believe must be followed in order to make sure that the daily routine appointments are not being disturbed. So the first step that you can follow is come up with a plan with the hospital CEO, CFO, admin staff, and physicians from each department. And together, everybody can decide what is the main goal of telemedicine, what is the main purpose of telemedicine, what are the important tools that must be encompassed in the telemedicine, to make sure that everybody gets what they want. The physician and the admin staff can provide the best time frame of when telemedicine should be implemented. So before going to the next step, everybody should give their feedbacks and suggestions on what type of telemedicine software should be chosen for each department. For example, an audiovisual one, video conferencing software. So like all these things are very important to be discussed. Step 2 would be evaluating the necessary tools that are needed to perform telemedicine. For example, the bandwidth, the broadband internet connection, computers, and microphones. So all these tools, everybody should focus on getting first before implementing the software. Step 3 would be testing out what kind of patients are open to telemedicine. So for example, young juvenile patients may not be like willing to try out telemedicine because young kids, they may not know how to express their symptoms properly over a computer screen. So in that case, you would need in-person appointments, or you can even have senior patients that may not be comfortable doing telemedicine. Maybe they don't have the devices that would be required to perform telemedicine. And in order to address the issue of testing out who is willing and who is not willing, you can hand out questionnaires to see what percentage of the population in that area is willing to even give this a shot. Step 4 would be that now that you have all the preliminary work done, you should be deciding what kind of software is needed. For example, you need to set up what kind of appointments are going to be covered by telemedicine. Also, like what type of insurances cover telemedicine. The last thing you need is patients paying out of pocket for these telemedicine appointments. But I don't think that should be an issue because with the coronavirus going on, telemedicine is such a common solution that a lot of hospitals have been following. Step 5 would be integrating telemedicine software into the Grand Hospital EHR, which is already implemented so that all the schedules can be in one place, and the staff is already familiar with navigating the EHR system. So implementing the telemedicine in the EHR system shouldn't be as hard. It wouldn't be novel to the admin staff since they're already used to navigating the EHR systems. Step 6 would be getting the staff and the doctors trained for the telemedicine software, which is respective to the different departments. So for example, teleradiology in the radiology department, telepsychiatry in the psychiatry department, and telemedicine remote software for ICU physicians would all require different tools that the staff must be trained for. And step 6 would be setting up a room where telemedicine will take place and ensure that there's enough lighting, there's no sound disruption, the room is soundproof, because the last thing you would need is like a patient standing outside the room and hearing a conversation between a physician and a patient. So maintaining the privacy and confidentiality of the patient, protected health information should be number one priority. So in order to ensure that, you must make sure that the rooms are soundproof. And the last step would be the optimization step. So this is where once the telemedicine approach has been implemented for about a month, getting feedback from the patients and the doctors and the admin staff, and collecting all those complaints or feedbacks together and making changes to optimize the software and provide maximum satisfaction and success would be key. And making sure you address all the issues and cater the needs and the needs and requirements that each department feels that needs to be implemented. So you basically fix all the problems and then modify the software based off of the needs of each department. So at the bottom over here, I have the implementation plan, like a Gantt chart, and how much time should be allotted for each task. So for example, the first task, which was setting up a meeting, I gave it about a week so everybody can think about it. They can implement, they can think about all the things that they require from the telemedicine software. Evaluating the tools was given a couple days, testing out what kind of patients are open. I gave that about a month so that everybody can fill out the questionnaire. We can have as much data on what percentage of the population is actually interested in going for a telemedicine approach. Step 4 is choosing the software. Step 5 is integrating telemedicine software into the EHR system. Step 6 is the training. And then step 7 is setting up a room where telemedicine is taking place. So step 8 is the part that I implemented that after a month over here, so that everybody has a chance to use the software, and then questionnaires can be handed back to everybody, and they can basically give their feedback on what needs to be improved. And based off of the feedback, you can make modifications to the software to improve the software to cater the needs of everybody. So that was it for today. I hope everybody liked my solution. And if you guys have any questions, please feel free to email me or post in the discussion section. Thank you so much for hearing. Have a nice day.